Today, this webinar will feature Dr. Sarah Meyer and Gita Swamy Meier-Ewert. They will be presenting on the experience of the CPC Learning Network and the United Nations High Commission for Refugees, UNHCR, in developing, piloting, and refining a Child Protection Index designed to assess child protection system strength in humanitarian settings. The format of the presentation will be as follows. Gita will first provide some context on why UNHCR was embarking on this research and the implications and challenges of this research for UNHCR. Sarah Meyer will then present findings from the study conducted in 2013 and 2014 in refugee settings in Uganda and Rwanda. We will take questions throughout the webinar, and I will share them with our two speakers after their presentations. If you have joined the webinar via the GoToWebinar application, you can submit typed questions on this pane in the questions box, which I will be able to see. If you have any trouble hearing or seeing the presentation, please also share that via the question box so we can try to correct any technological glitches. Now I would like to introduce our two wonderful presenters today. Gita Swamy Meier-Ewert is a Senior Planning and Monitoring Specialist at the United Nations High Commission for Refugees. She currently works on monitoring and evaluation in the area of protection in UNHCR's Division of International Protection, focusing specifically on sexual and gender-based violence, child protection, and education. She spent much of her career working for the German Development Cooperation, UNDP, and UNHCR in a number of countries, including Kenya and Sri Lanka, on issues related to linking humanitarian assistance to development, crisis prevention, as well as strategic planning, and monitoring and evaluation. Sarah Meyer is an assistant professor in clinical population and family health at the Mailman School of Public Health at Columbia University, and the associate director of research and knowledge development at the Center for Excellence for the Study of the African Child, also known as the Africhild Centre in Kampala, Uganda. She has extensive experience managing and leading research projects focused on migration, child protection, and mental health in humanitarian and low-income settings, including the Thai-Burma border, Cambodia, Rwanda, and Uganda. She is currently the co-investigator on this joint study between the CPC Learning Network and UNHCR, measuring child protection in refugee settings, which is being presented today. One final note, this webinar is being recorded and will be shared on the CPC Learning Network website, which is www.cpcnetwork.org, in the News and Events section later this week. Now I would like to turn this over to Gita to start us off.
Okay, thank you, Eva, and good afternoon or good morning, everyone. My name is Gita Swamy Meier-Ewert, and as Eva said, I work in UNHCR's Division of International Protection in Geneva. And I'm very pleased to introduce this webinar and the findings of the assessment studies on measuring the impact of child protection. And first I want to thank Eva and the CPC Learning Network for organizing this webinar, and also to Sarah for presenting the research and the findings today. And also I want to say a big thank you at this point to our UNHCR offices in Uganda and Rwanda who are hosting this important research. Before Sarah starts with her detailed presentation, I would like to say a few words from a UNHCR perspective, why we actually embarked on this research. The research findings that Sarah will be presenting today have their roots in UNHCR's framework for the protection of children that UNHCR developed 3 to 4 years ago. And the framework reconfirmed UNHCR's commitment to the protection of children and defined what we call a systems approach to child protection. And as you might know, the framework sets out 6 broad results and results areas that are very critical for achieving the protection of children. And the overarching vision of the framework is to enable children to live without exploitation, neglect, and abuse, and to ensure the overall well-being of children. And as such, the framework has very strong links to UNHCR's work and strategy in sexual and gender-based violence, as well as to UNHCR's strategy in the area of education. And once the child protection framework was developed, we, or UNHCR, wanted to step up its effort in monitoring and evaluating the protection of children. And at this point, about 2 years ago, some of the really pressing issues that we were asking ourselves were, what impact are we actually achieving with the child protection systems approach? And secondly, the second big question for us was, how can we measure the impact that we're achieving? So we were trying to look into these two questions in more detail, and we wanted to use the tool of an index as a practical tool that will give us an answer to these two questions. So we started thinking about those two questions about 2 years ago, trying to conceptualize how we would go about those two questions in the context of the framework. And we were able to operationalize our ideas with funding from the US government under an initiative called Safe from the Start, that focuses on creating a safe environment as soon as possible after a big displacement and at the beginning of an emergency. So to look into those two questions, we asked the CPC Learning Network under the leadership of Lindsay Stark and Sarah Meyer to develop an assessment methodology as well as an index that are both based on UNHCR's framework for the protection of children, and to use population-based research and other research tools available. And the context chosen for testing and applying those tools were refugee populations, first in Rwanda and then also in Uganda in 2014-15. And one of the big challenges for us that we faced quite early on was to look at how can we strike a balance between ensuring academic rigor and having something practical and sort of simple that our field colleagues could also use by themselves. And for us, the collaboration with the academia was extremely important because we wanted to ensure that any impact assessment approach was robust and grounded in latest thinking on assessment, child protection, and sexual and gender-based violence. At the same time, we also wanted to see how can we actually develop a tool that is easy to use and that our operations can use maybe on a regular basis, maybe yearly or every second year. And as you will see, we have now developed a robust tool. And so one of our dreams for the future is to see how can we actually develop these tools that we have now into something practical later on that can be used much more often than we're able to use them now with our current resources. So until at the moment and until we have the final assessments done, we are really trying to learn the lessons from how can we apply the methodologies on impact assessments, what are the lessons that we're learning both on measuring impact but also measuring protection. And as we all know, measuring protection is not something easy. It's something that is complex and requires to look at different levels and different aspects. So this research assessment has really helped us to look much deeper into different angles of protection and to drill deeply into what can we actually measure, what can we not measure, and how feasible is it to actually use an index for measuring change over time in the protection of children. With this sort of short introduction, I'd like to hand over to Sarah to present more details on the assessment and the research itself, and then also present some of the findings from the studies in Rwanda and Uganda. Okay, thank you, and over to you, Sarah.
Thank you so much, Gita. I really appreciate it. So I'm really happy to have the opportunity to be here today and to share some of the initial findings from this project. As Gita mentioned, a collaboration between CPC Learning Network and UNHCR. I should of course mention the principal investigator, Dr. Lindsay Stark, director of the CPC Learning Network, and as Gita mentioned, many of our in-country collaborators. So in each country, we've conducted this study with a local research partner in Rwanda with AFSI Rwanda, in Uganda with TPO Uganda, and of course we have collaborated and have great appreciation for UNHCR Geneva and the UNHCR country offices. So I just wanted to start with a very brief overview of what I'll be talking about today. And so firstly, to talk about measurement of child protection. As Gita just mentioned and introduced, it can be complex, very multifaceted to measure protection, and what have we tried to do in developing the Child Protection Index, and how have we really tried to ground that in previous and ongoing discussions around measurement of child protection systems and systems approaches really to child protection. So then to also go on to the Child Protection Index, which is the instrument developed as part of this study. How did we develop it? How did we refine it? And what are some of the key components within it? I'll then present some results from Rwanda and Uganda. As Gita mentioned, there is a longitudinal component of this study. There will be follow-up studies in both of those countries. What I'm presenting today are baseline results, and so they'll indicate some of the directions of the research, some of our initial findings, and some of the possible, as I'll then go on to mention, some of the possible challenges and next steps that we hope to engage in. So firstly, measurement of child protection, and really what do I mean by a systems approach, and where have we really grounded this research? So firstly, in talking about a child protection system, some of this thinking emerged and came out of some discussions and publications from UNICEF, but also, and I'll note this in a few moments, has really been part of UNHCR's thinking around child protection for refugee children for many, many years. When we're thinking about and talking about what a system is, it's defined by UNICEF as a collection of components or parts that are organized around a common purpose or a goal. So within child protection, systems thinking is really around trying to create and promote a holistic view of children and child protection that engages with a range of actors involved in protecting child rights. And some of the shift towards this kind of thinking within child protection work globally, both within development settings and also increasingly in humanitarian and emergency settings, has been recognition of the problems with standalone approaches to child protection. So for example, separation of some types of prevention and intervention programs, targeting specific groups of vulnerable children, so defining street children as the target or defining children associated with armed forces as the target, and really only addressing those specific problems rather than addressing some of the root challenges and underlying social problems. So some of the recognition of those weaknesses or limitations in some of the standalone and separated approaches to child protection really brought up an interest in systems thinking and a greater commitment from a number of organizations to systems thinking. And also there was thinking that there is actually such a thing as a distinct child protection system. There are health systems and education systems, and they go some way towards building a protective environment for children, but they're not enough to address multiple and overlapping protection needs. So there was recognition of a need for a more holistic approach to understand children as grounded and embedded within their families and communities. And as I mentioned, some of this was pushed by UNICEF thinking, but it's also been addressed in a number of different ways. And so what I have here is some of the key ways and key approaches that researchers and organizations have really addressed systems mapping. And so once we've started to think around child protection systems, how is it that we would or could understand what the system is and how is it working? So one of those approaches, which I'm sure many on this webinar are familiar with, as it really came about through a lot of CPC research led by Mike Wessels and others, is community-based child protection mechanisms, and really mapping from a bottom-up approach some of the ways in which individuals, families and communities create and respond to child protection needs. And so it's really understanding what is it that communities are doing, mapping that, and then viewing how that system approaches and responds to child protection needs. So that's been one of the approaches. Another one of the approaches to mapping has been really engaged a little bit more in formal systems and has been led and really initiated by Maestral International, and looking at really a more formal view of a child protection system. So looking at laws, policies, human resources, financial capacity, looking at what the system actually currently does and helping to try and identify some priorities and gaps within that system. Then the third approach here, which has really been initiated and led by Child Frontiers, is kind of a combination of the bottom-up and the more formal system, but looking at comparing and mapping that official formal system, and then also comparing and mapping that to what families and communities actually identify as their prioritised needs and what they want and need from the child protection system. So for example, in using that approach in 5 countries in West Africa, they found that what the formal system did, was actually not really responding to what some of the most important issues that had been identified by communities was. So for example, a focus on family problems and family responses to child protection issues. So there was really a lack of congruence between the formal system priorities and strategies and community conceptions of child protection. So here, this approach is really trying to explore the actual functioning of a system and how that maps onto communities' needs and actual child protection outcomes. So we've really used this as a launching point for our study in order to really try and combine different approaches in terms of understanding what the child protection system is, what it does, also understanding how that maps onto what communities and children within those communities need, and then taking that a next step forward. And before talking about where our research has taken that, I wanted to really frame this conversation within UNHCR's framework, which Gita described, and also the systems approach within that framework. So the framework, which was launched in 2012, really marks, as noted here, an institutional shift from mainly targeting categories of children at risk towards a systems approach to protecting children. So from this standpoint, the framework really engages with the ways in which systems operate at community, national and international levels, and that the various actors within that system that can be strengthened, and that system strengthening can be achieved in numerous ways, including the legal and policy framework, but also including human and financial capacities, prevention and response services, and the ways in which the child protection system is defined here and the different actions towards system strengthening are defined within the framework really grounds that discussion and grounds this research also within broader discussions within the child protection field, and also specifically around child protection in humanitarian settings and system strengthening in those contexts. One thing to note here though, and it's made explicit in the framework and in other policy documents within UNHCR, like as I note here, the 2007 Executive Committee conclusion, is that UNHCR is careful and wants to ensure that its actions don't create a separate and additional child protection system for refugee children, and that approach should not be fully disconnected from strengthening national child protection systems, because in some cases that could allow states to exclude refugee children from national services, from national child protection systems, so that it really should be complementary to what states are doing, that states should promote and establish and implement child protection systems that benefit refugees, and where there are gaps and where there are specific needs that are not being met for refugees, that UNHCR and other partners would help and support the state to fulfill their obligations. So that's important for the understanding of how UNHCR understands child protection systems, but also in that we're in developing the Child Protection Index, not trying to create something separate and beyond the national child protection system, but that in fact a number of indicators draw on aspects of the national child protection system in the case of this study in Uganda and Rwanda. So then to go specifically onto this study and the Child Protection Index in the context of what I've been discussing. So the overarching goal really is to develop and implement this index to demonstrate and really test a proof of concept that a well-implemented child protection framework can protect refugee children from harm. So essentially this is seeing UNHCR's framework as a policy and set of interventions that is intended to strengthen the capacity of communities and families, as well as national and international actors, to prevent and respond to child protection risks, and then in turn to improve the well-being of refugee children. And the way in which it's also building on the Child Frontiers work, which I mentioned, is as well as mapping a more formal child protection system and linking that to how well is that responding to child protection needs, it's also trying to understand and analyse, as Gita mentioned, the impact of system strengthening. So does a strong child protection system actually result in changes for children, families and communities? So the hypothesis and the assumption behind wanting to strengthen a child protection system is that we assume and hypothesize that that would reduce harms, reduce violence, abuse and exploitation, and improve well-being for refugee children. So testing that hypothesis and seeing, do these changes actually result? If so, what kind of changes? And do we see that changes in the child protection system over time lead to positive changes for children and families? So this is really a first step towards a more rigorous understanding of impacts and understanding the congruence or the linkages between UNHCR's framework and activities and what it is actually addressing and doing. So there have been, as I mentioned, a number of attempts to measure systems and systems approaches, and we're taking this just one step further in trying to see how systems actually affect families, communities, and individual outcomes for children. So here I'm just demonstrating and sort of explaining that through this research logic model, looking at the hypothesis that the strength of the system as measured through the Child Protection Index leads to certain outputs and outcomes that we measure through surveys, focus groups, and key informant interviews, that those outputs and outcomes, including knowledge of systems, knowledge of activities, reduction of vulnerability, and access to key services, that changes in those also lead to measurable changes in the important impact areas that UNHCR's framework is really based on: reduction of exposure to violence, abuse and exploitation, and measurable improvement in psychosocial well-being as well. So then just to move on here into what is the Child Protection Index and what does it include and how did we develop it? So it's really grounded and framed within the indicators and benchmarks that are in the framework, and is aimed to operationalize the framework and use it as a measure of child protection system strength. And within that, we've categorized and included three separate sets of items, and what we see as three separate important components of a system. So the first being services, including items focused on the role and functioning of key services for child protection. So communal space for adolescents, safe learning environments, activities such as technical and vocational activities, recreational activities, life skills training. Some of those key aspects of services are included in that component. The second aspect is utilization, and here we're trying to develop that as a proxy for quality of services. We know that we don't want to just mention or measure, the presence of services, but actually measure how well are they doing and how well are they responding to needs. Because we're measuring a wide range of services, it's very difficult to go in great depth into each of those services and what they include and give them a rank out of 10 or some kind of quality measure for each service. So instead, at least in this part of the measurement, we're using utilization to indicate that people are responding to that service, they know about it, that they use it. So we measure a range of items here on participation in activities, on reported feelings of safety in school and school attendance, and participation in clubs and committees, reporting of experiences of SGBV. So that is the aspect of utilization. And then the key aspect of policies and procedures. So this really includes items that are focused on the existence and operationalization of the key policies and procedures that prevent and address child protection risks. So that might include best interest determinations, laws and policies to address statelessness, access to national education systems, provision of birth registration, and other aspects like information sharing and coordination mechanisms, such as a child protection working group. And it should be noted as well here that the primary source of the data that goes into the Child Protection Index is interviews, key informant interviews with child protection practitioners and people involved in the child protection system within that particular context, and that some of the items are also drawn from surveys with adolescents and caregivers, which I'll mention in a moment. Some aspects of index development were the study in Rwanda in December 2013 was really conceived both as a baseline study but also as a pilot. And so there we were very inclusive in the number of items in the index. We tried to measure all sorts of aspects of the framework, and so that resulted in a pilot index that was 141 items, and also included subjective and objective items. So there were measures in that iteration of the index that included questions to key informants such as what is your perception of the quality of different services, and then asking them to rank that. So following that experience, we found that on both of these aspects we really needed to make some revisions. Firstly, as Gita had mentioned, the ultimate aim of the study and the ultimate aim of this collaboration is to be able to create workable tools and instruments that could be used outside of a pure research environment. And so something that's 141 items and takes a very long time to collect that much information was not really workable even in the fieldwork context, but even more so in the future. And so we really worked to reduce that and to try and include items that were really getting at the core concepts in the framework. And that also, as noted, these subjective items really depended, the responses really depended on the position and the expertise of the respondent, and it was very difficult in analysis to then reconcile conflicting data. So we tried to shift much more towards having purely objective and even often observational measures within the index. So here I have a couple of questions, couple of items that have been retained within the index that come under some of these different areas. Just to mention a few of them, so under services, is there a communal space, yes or no? Under utilization, we measure through the survey the percentage of adolescents who had experienced violence, who had reported that experience. And under policies and procedures, exploring for unaccompanied and separated children, what are the durable solutions that are currently available? So for all of those, as I'll discuss in a couple of slides as well, there's scoring and weighting assigned, and so a yes might be 2 in one case and in another case might be assigned 4. But through all of those items and tallying up those items, we get to a measure of system strength. And then the final aspect before I go on to findings is that, as I've mentioned, we're trying to look at outcomes and then eventually through the longitudinal aspect to look at impacts. And so we have, in order to measure those areas, adolescent and caregiver surveys. We've interviewed adolescents aged between 13 and 17 across the 3 sites, and so there was the research was in 1 refugee camp, Kiziba in Rwanda, and in 2 refugee settings, Adjumani and Kiryondongo refugee settlements in Uganda. So across the 3 studies, we have 633 adolescents within who have answered surveys. Those surveys really included measures of psychosocial well-being, exposure to different child protection risks, including experiencing and witnessing violence in the household, in schools, in the community, and there is a focus on sexual and gender-based violence, aspects of perceptions of safety, and knowledge and utilization of services. And the other aspect in the caregiver survey as well, we wanted to include factors that we thought might influence child protection risks or child protection outcomes, so socioeconomic status, perceived humanitarian needs and priorities, and then also based on previous literature and the understanding that caregiver well-being can be quite important and influential on children's health and children's child protection risks. Also included measures of caregiver well-being measured through depression and anxiety. We added in the Uganda studies a qualitative component to further investigate the linkages between child protection, the system strength and child protection outcomes. And so these focus group discussions really focused on identified priority needs and the services and responses that adolescents felt were needed to address these needs. So now to move on to results. So this table here shows the ratings that Kiziba Camp in Rwanda, Kiryandongo in Uganda, and Adjumani in Uganda were given on this range of utilization, policies and procedures, and services. So some interpretation of this. So for Kiziba Camp, the index indicates that the system really performs higher on presence of services and procedures and higher than utilization of those services and procedures. And we noted in the surveys and in the key informant interviews that some important components of utilization, most notably reporting of violence or abuse or receipt of services after violence of abuse and abuse, were quite low and were not reported. So while data collected using the adolescent survey indicated that knowledge and awareness of these systems were high, it was not clear that this knowledge translated to adequate utilization of these systems, resulting in improvements of child protection. So further investigation and exploration of barriers to reporting, accessibility of these services, and really appropriateness of these services appears warranted based on these findings from Kiziba. Some of the aspects of the comparison really that we've been analysing between Kiryandongo and Adjumani is that, as you can see, there's quite similar rankings on policies and procedures and on services, but quite a lot lower ranking on utilisation in Kiryandongo. So much lower percentages of adolescents who were reporting school attendance, feelings of safety at school, utilisation of key activities like life skills training or structured recreation activities. So a later slide will look into possible interpretations of this. But to go on here and to present some of the key child protection outcomes across those three settings. So some of the child protection risks and exposures that we measured included physical violence experienced in the past year or a specific period of time. And here I should note that the questions that were asked in Rwanda asked about past year experience, but in both Uganda and Adjumani, refugee children had arrived in the refugee settlement often less than a year prior to the study. And we really wanted to measure and assess their experiences after having arrived in Uganda and how that was responding to the child protection system here, rather than measuring and picking up their pre-flight and experiences during conflict in South Sudan. And so we picked a period of time, last South Sudanese Independence Day, so these numbers are not directly comparable in that they're measuring slightly different periods of time. But what I wanted to draw out in the next slide is that there's really some significant differences between Kiryandongo and Adjumani that come out in these numbers around child protection risks and psychosocial well-being. So for example, reporting of physical abuse was significantly higher in Kiryandongo compared to Adjumani. The percentage of caregivers that reported that their children had been injured while walking around the settlement was much higher in Kiryandongo compared to Adjumani. This pattern really mapped onto a number of different outcomes: feelings of safety, feelings of skipping school because of feelings of feeling unsafe at school, and finally also on some of the psychosocial measures, both anxiety but also depression outcomes were much more significant symptoms in adolescents in Kiryandongo compared to Adjumani. So while this data is from one time point, and therefore we cannot create or hypothesize a causal association between child protection system strength and adolescent well-being, this pattern in findings does indicate support for the hypothesis that's being tested here, that child protection system strength, recalling if we go back that Kiryondongo had a lower system strength, is associated with particular child protection outcomes. So then just to build on these findings a little bit more with some of the qualitative findings in Uganda. And again, this aspect of the methodology was not carried out in Rwanda, so I'll just draw here on the focus groups that were conducted in Kiryondongo and Adjumani. Firstly, these focus groups were able to identify problems that had not been explored in the surveys. And so one aspect was forced and early marriage, which was identified as not necessarily a very prevalent problem, but quite a severe problem that obviously had very significant implications for young adolescent girls. And so in picking this up and also in picking up the next issue of significant discrimination against unaccompanied and separated children within households, both of these aspects gives us an indication of future components that we could include in the follow-up survey, of ways in which we could understand the linkages or the lack of congruence between the child protection system and child protection outcomes. And we also were able to use the qualitative findings and really see that they confirm some of the findings from the surveys. So the prioritization and identification of the real problem of violence against children within households. And so in every focus group, children identifying caregiver violence against them within households as a priority issue, and also vulnerability of unaccompanied and separated children. So within our research in Adjumani, we had a separate subset of unaccompanied and separated children who responded to the survey, and comparing those results to other results, we were able to see some of those aspects of vulnerability come out. And here as well, and the real purpose of the qualitative mixed methods approach here is that we were able to shed light on issues of quality and issues of the appropriateness or the linkages between the child protection interventions and community needs. So, for example, adolescents across the focus groups identified, as noted here, unaccompanied and separated children as a particularly vulnerable group who may be discriminated against, prevented from attending school, and who may experience higher levels of physical and verbal abuse within households, within their foster care situation. The items that we have within the CPI, within the index, that are focused on unaccompanied and separated children are primarily focused on policies and procedures, whereas this is really bringing out that aspects such as quality of living arrangements, equitable access to educational opportunities, and experiences of discrimination may be really particularly important, and that while it doesn't seem that there's gaps in formal policies and procedures, it may be that discrimination against unaccompanied and separated children and the problems that they have in their relationships with foster caregivers needs further attention in order to really achieve the child protection outcomes for this specific group that UNHCR wants to achieve. I'm going to start to wrap up here and focus a little bit on some of the challenges that have been encountered, some of the challenges that come out in this analysis and in this presentation, and then just to touch on our next step. So one aspect that I mentioned was assigning scoring and weighting of items within the Child Protection Index. And so that is inherently a subjective and also collaborative aspect of this study, in that it is quite difficult to decide that access to education for children with disabilities should be given 2 points, whereas reporting for access to referral mechanisms and reporting for SGBV should be given 4 points. And obviously the weighting that we give particular items results in the assessment of system strength, so it's really at a core of this study. We've tried to address that through that being an iterative conversation, that being aspects that we've changed and moved around from the Rwanda to the Uganda study, but that's still a work in process. And in index development, this kind of aspect of the weighting of items really relies on there being a number of data sets to be able to compare findings across. So we hope that in doing the follow-up studies, and also hopefully in having this index used in other contexts, would actually help us to really refine and make more clear and grounded the weighting of the items. The other aspect is the challenge of interpretation of system strength. So we saw on an earlier slide that Kiryandongo refugee settlement in Uganda scored much lower for utilization of services. So there's a number of different interpretations of that. It could be that the services are not of a high enough quality that refugee families or children would want to use them. It could be the services are not accessible, they're in a different part of the settlement they can't get to, that they have to pay a fee, or that there are no translators. There are aspects of accessibility that could be at the root of that. Or it could be that the services are not relevant or appropriate to refugees' needs. And so what we're really trying to do with that is triangulate data, use the qualitative data to shed light on that interpretation, use some of the findings in the adolescent survey to shed light on that, and then a final step at this stage is that we'll be doing dissemination visits to Adjumani and Kiryandongo and having meetings in Kampala in the coming weeks and months, and to also discuss in various fora with child protection experts and practitioners, with refugee leaders, how they would interpret those findings and how they would understand that aspect of system strength. Another challenge, finally, also, and Gita touched on, that we want this to be a practical tool to be able to use in other settings, and we come across a challenge there in really trying to balance specificity and generalizability. So we may want to really measure the specifics of a particular context, taking into account particular cultural components, particular specifics to child protection risks within particular communities, but we also would like to be able to use the CPI in different contexts and to be able to generate comparable data. And so in that we've talked and have had discussions around, the CPI could have an additional module that could be developed for specific contexts, and we've had conversations around it being used in baseline studies in Rwanda for the Burundian influx, and so how would we need or how could we adapt that while still having it be another data set that then could be compared to these other settings. So I think that there's ways in which to balance that, but I think it could be something that is a challenge when we try to adapt this beyond these studies. And then finally, just to touch on next steps, and then we can open it to questions, but really the longitudinal component is at the heart of this study, and really when we're doing the follow-up study later on this year in Rwanda and then in Uganda again in early next year, what we're trying to ask and what we're trying to see is how or if system strength changes over time. Do we see different ratings overall? Do we see some changes on particular items and not on others? How do these changes relate to actual changes in child protection outcomes? And really then I hope that that will bring us to this next step, and really what is innovative and a contribution to this field in terms of linking perceptions and actual system strength to child protection outcomes. And so I'm going to leave us there, and then I'd be very interested to hear any questions, comments, feedback. Go ahead.
Thank you very much to both Gita and Sarah for these fantastic presentations. So just so everyone knows, there's a question box on the GoToWebinar pane in which you could submit questions. I see some people are already submitting questions, and thank you so much. So please feel free to submit questions that way, and I will share them with Sarah and Gita to answer right now. So your first question is, what did the ethics and safeguarding protocols look like for this research? And was there a particular safeguarding framework or references that you used?
Right. Thank you for that question. And for the interest of time, I did not go into a number of those aspects, which are really key, obviously, in such a sensitive, asking sensitive questions and working with vulnerable populations. And so, in general, so every interview prior to interviewing the caregiver gave their own informed consent. They were then asked permission to interview the adolescent, and the adolescent also then gave their informed consent. In both settings, we did record names and contact information because we hope to be able to follow up with, if this ends up being feasible, to follow up with the same individuals in the follow-up study. All information, all identifying information, once data had been entered, is kept in a separate database. So none of the linkages between the actual data and names and locations can be found in one place. In both studies as well, I'd say both studies, and now that I'm working on, in Uganda, the National Violence Against Children study, I can see a lot of ways in which this happened. A lot of what we did also was drawn from these violence against children studies that the Centers for Disease Control have done in a number of countries, because other aspects included that adolescent girls were only interviewed by female data collectors, especially around issues of disclosure and safety. That's really key. And then one aspect of what the Violence Against Children studies does is that the caregiver survey is really also a component of having the caregiver actually engaged in the study. So there is less chance or less concern that the caregiver is resistant to or potential to retaliate against an adolescent who's been involved in this survey. So it's sort of a way of engaging with the household that could really provide some safeguarding. And then also that at the end of every interview, respondents are given a list of services. That list of services doesn't only mention services for SGBV, but mentions all services in the settlement or the camp, so that it's not clear, if someone finds that piece of paper, what was being discussed. So those are really the key components. Also obviously training of data collectors and having data collectors sign a child protection policy, having any violations or any concerns around confidentiality issues with data collectors be addressed, have a very robust and detailed aspect of training that focused on human subjects research ethics. So those are the components of the study that respond to your question.
Thank you very much. So the next question that we have is, how does the Mistral mapping system work that you mentioned in the beginning, and how does it differ from the other two mapping systems that you had mentioned?
So the Mistral mapping system, and I wish I could now bring it up in front of me, but there's this very detailed Excel spreadsheet, and essentially Mistral brings together key informants and steering committees, and there might be a steering committee that's specifically on human resources and on capacity. It's very much engaged with framing and understanding child protection from a much more centralized level than the other two, I would say. So it's really looking at where does child protection system sit within which ministry. Being in Uganda right now, it would be, going to the Ministry of Gender, Labour and Social Development, working out who does what, and then mapping, and there's this formatted Excel spreadsheet that is meant to be a tool that any country can use to fill in and say, how much do we spend on this? How many social workers do we have? How many response services do we have? How many volunteers do we have? And how are they geographically spread? How is that spending played out across the country? So what I would say is it gives you a snapshot of what is being done often in quite a centralized way. And so what that real contrast to the bottom up and to the community-based child protection mechanisms is that that's not about what's been funded or what is counted as a formal activity and what was its output, but is really going to communities and saying, what is it that you do when you come across a child protection issue? Who do you go to? When you go to that person, is it an imam? Is it a church leader? Is it the local council person? What do you expect them to do? Where do they go? Where do you go if you want to escalate that case further? What are the different solutions? There are solutions that range from going to the police to addressing it through, family dispute mediation, there might be a payment involved. So that's really, really grounded in how communities respond to those needs. And then Child Frontiers is trying to kind of bring those two together and say there are likely pretty significant gaps in the formal systems. I mean, often these mappings, the Maestro mappings have shown there's one child protection worker for, if you're lucky, 20 to 50,000 people. Okay, so what is it that they're not really going to be able to address, and what is it that communities are doing within those gaps? Where they do interact with the formal system, what is their experience, and why would they choose to go to the formal system versus address something at the community level? So I think that they can be quite complementary approaches. I think the Maestral approach is definitely a way to have a snapshot of what is happening and how could it, I mean, I do think that formal system strengthening is needed for a lot of these activities to be sustainable, but what it doesn't do is ask whether these activities are actually what communities would prioritize, or, you know, were there enough child protection workers to go around, would that actually be what communities were looking for and how they would choose to respond to their child protection needs.
So I've received 7 more questions, which I'm sort of grouping by category. So if you have another question, please submit it now so we can make sure to address all of them. So 2 questions that are very similar. The first is, when will the follow-up studies take place? This number is saying, I think it would be good to leave some time, at least 1, 2, maybe even 3 years in between, to be able to measure more reliable changes over time. And the second question related is, what do you believe is the timeline to measure impacts of strengthening the child protection system? So seeing whether it results in changes in children, families, communities, as you had mentioned.
Right. I mean, so our follow-up study for Rwanda is scheduled and in the planning for October this year. So that will be actually an almost, from December 2013 to October 2015. So there'll be quite a gap of time, almost 2 years between those studies. And the follow-up study for Uganda will be in around April next year. So that will be a smaller gap. It'll be a bit over a year. In terms of, you know, ideal timelines for changes from the perspective of, you know, seeing various changes over time, it would be ideal and a dream to be able to do, you know, a T3 study, to do an additional year later for Rwanda and an additional year later for Uganda, and see changes and fluctuations and not just change from one time point to another. Obviously, you know, everyone is constrained by resources and timelines and you know, project constraints and all of those aspects. But I do think that the time frames we have in between these studies are adequate to see changes, and I do think that change is actually very rapid, particularly in Uganda, because both Kiryandongo and Adjumani, there was a real ramping up of activities in response to the influx of South Sudanese refugees, and so we have seen already significant changes in the system, and I would think we will see changes. What those changes will look like, whether it's system strengthening, whether it's less funding because it's not seen as much of an emergency, and so less activities. That's really, you know, up for measurement and up for what we're exploring, wanting to explore. And so I don't think that it's, because this is really a proof of concept kind of a study and really something that we're trying to test, I don't think it's as clear cut as in, say, another field where you would say, okay, in order to adequately measure, say, behavior change, we need X amount of time, or we really won't see reduction of prevalence of a particular issue over, you know, a smaller time than 1 year. Here, you know, we're a little bit more in the dark, but I do think that the time that we have between these studies will show us changes. I think certainly, you know, if we had longer, or if we had another component of the follow-up, that we would see different types of changes. And I think in any types of studies, you have to also sort of say, well, then what happened? And so that will be the same here as well.
Fantastic. Thank you so much. So there's a few questions about the different indicators that were brought up. So I will give you these 3 questions together. The first is, which aspects of the CPI are truly specific to refugee children? The second is, did you try to find out why specifically unaccompanied and separated children are exposed to vulnerability at the household level within the CPI? And which indicators did you use to assess the impact of this study?
All right, so within the CPI, it really, all throughout it, there's different indicators that are very specific to refugee children and to humanitarian settings. Within the ones that I can think of most clearly are really policies and procedures. And so you have things such as, is there a panel that meets to do a best interest determination? So a best interest determination being a particular procedure that is designed to work out what to do with children in displacement settings who are, not in a setting with their caregiver, or unaccompanied or separated children, or children who are being resettled. Who should they be going with? Should they be given foster care or some kind of arrangement? So best interest determinations, birth registration. Birth registration is an issue certainly for Ugandans as well. It's a very low prevalence of birth registration here as well. But for refugee children, that's specific in that if they don't have very formal birth registration in Uganda, and then they repatriate from Uganda to South Sudan, or from Rwanda to Congo, then that really can induce statelessness if there's no record of anywhere that they were born and they have no registration or anything formal that would be recognised. There's aspects such as, are refugee children allowed to be part of particular national processes, such as primary and secondary education, access to different services that, maybe on paper may be allowed, but whether really in practice that's possible for refugee children. So there's quite a lot that's specific to refugee children, particularly within policies and procedures. And then the other aspects that are specific but may also be activities that are beneficial for non-refugees are activities that are implemented, as part of the child protection framework. So really life skills training, access to communal safe spaces, child-friendly spaces, those components of humanitarian response that are present. So I would say that if you compared the CPI to something that was trying to measure national child protection strength, there would be aspects that would be quite different, although the components and the aims of the components are very similar. You have policies and procedures that allow refugee children to access basic rights, to have education, health services, that you have activities that they want to be part of that would potentially reduce risks and improve well-being, and that they want to utilize those services and that they're of a high quality. So how did we identify that unaccompanied? Maybe actually could you repeat that second question?
Sure. So this question was specifically asking about vulnerability at the household level pertaining to unaccompanied and separated children, and whether there were questions about the cause or the different types of vulnerabilities.
Right. So that's still something that we need to do further discussions at a field level about, I believe. And so understanding, so we heard from focus groups that this was really perceived as a major problem that they knew of, or themselves were unaccompanied and separated children who had caregivers who wouldn't allow them to go to school, or who gave them extra chores, or who created these additional issues for them, who discriminated against them, and that was despite the fact that there seemed to be quite strong policies and procedures in place to identify and respond to these children. So that's really the level at which we were able to understand that vulnerability at the household level at this point, and that both within the baseline study in our dissemination meetings, and then also within our follow-up research, we would like to explore further what that really means. What does that discrimination mean? why is that happening? Are there services or ways to prevent that that would improve the quality of life of unaccompanied and separated children beyond what is happening? And then the question around what indicators are used to measure impact. So within the survey, there are the indicators that are around child protection risks, so exposure to violence, abuse and exploitation. There's some measures on child labour, there's measures on transactional sex and any experience of SGBV, verbal, physical abuse and neglect. So those are really the key indicators that we've been looking at change over. And then also understanding psychosocial well-being. So really this study also tries to operationalize, well, what would we like to see when or if these risks reduce. We would also like to see that that means that children are actually doing better, that they are functioning better, they have higher functioning, they have lower symptoms of problems, and so that's another key area of indicators.
Fantastic. Thank you so much, Sarah. So here's another group of 3 questions that are sort of grouped together, I guess, by rollout. So the first is simply, how are you planning to roll out the utilization of the CPI in other settings and countries? The second is asking, how might the CPI be used in an IDP context instead of a refugee context, and what the differences and changes might be? And the third is a request from a team member in UNHCR Tripoli asking whether it would be possible to receive the CPI tools and possibly pilot in North Lebanon, where the Syrian emergency response is now transitioning towards more development-focused CP systems.
Okay, fantastic. So the first aspect of rolling out of utilization is that, you know, when we've been able to do follow-up studies, I think that there can be utilization now of the index, and to respond to that final question, we're very open to sharing the tools and to orienting colleagues and different partners on how to use them and how to put together a team and how to do that kind of a study. In terms of actual rollout, we're envisaging a practitioner-friendly kit that has the tools, that talks about the steps in implementing this kind of a study, that talks about the different aspects of support that would be needed, and that aspect of the rollout we would do further along so that we can really include all of the learning that we've been able to do. So after both of the follow-up studies, can we include just much more refinement of the different weights in the CPI, refinement of the survey instruments, you know, advice around sampling and those kind of issues. So in terms of, you know, how might the CPI be used in IDP context, and also it should be noted that not through the CPC Learning Network, but through another partner, there is an effort to pilot and use this in an urban setting. So we know that where we piloted it, you know, represents some of the world's refugees and displaced people, but certainly doesn't really cover the breadth of situations that we would want to be able to test this in. So in IDP context, I mean, I think it would depend very much on the way in which people have been displaced. Have they been displaced within an urban setting? Are they now in a city? Are they now in a rural setting that is very similar to a refugee camp, and so some of the same aspects could be used? Are there additional issues in terms of sort of safety and protection and ethics safeguarding where IDPs are not yet necessarily in a fully protective environment and might still be targeted by government? So I think it would for me, that would need some thinking through of what type of IDP context. Also, you know, to bring up and what the question around, you know, the Syria response brings up is that also, you know, testing this in environments that actually have national child protection systems that may be higher functioning. So if you're looking at Lebanon or Jordan or some of the countries that, you know, are bearing the brunt of the Syria crisis, that there actually may be systems in place that, you know, are very, very different than what we're looking at here in Rwanda and Uganda. And although they also need, you know, significant strengthening, that it's a very different, not only cultural environment, but socioeconomic environment, and so understanding some of those aspects would be what would need to be brought into adapting the CPI for other contexts.
Fantastic, thank you. And I just would like to give Gita the opportunity to jump in and answer any of these as well. So please feel free to jump in.
Yes, thank you. Eva, I just wanted to add as well, Sarah has hinted to it already, that we are now in the process of adapting the tool and the methodology and to test and apply it in an urban setting. Because as we know, many of UNHCR's people of concern live in urban settings, and people face very different challenges with regard to protection and assistance, especially children. So we will be doing this kind of study in an urban context this year, and following the same process as we've done in Rwanda and Uganda. And we will be doing a follow-up study as well, 1.5 or 2 years later. So this urban component is one of our attempts to adapt to the different environments that UNHCR works in. Okay.
Fantastic. So I have one question that I believe will go to both of you. So question is, I recognize that this is still in pilot phase and for UNHCR, but could you discuss the time frame for collecting more data for the CPI and how this feeds into protection analysis and the protection strategy development for interagency engagement and response? How could this approach complement other assessments such as the rapid response?
Gita, did you want to address that?
No, go ahead, Sarah.
So some aspects of what we've done, including convening an advisory board and having people on that advisory board who are part of a number of those different processes, is to really try and link this work in with a number of those aspects. As noted in the question, we're in pilot phase and also still working out where this would develop and where it could go. But yes, there are rapid assessments, and yes, there are various types of tools to identify and understand child protection in humanitarian settings, and could we work on introducing this tool within a number of those fora? And then that's also where we have been working quite closely in the last few months in really identifying and developing a dissemination strategy to work out exactly how to engage with those different processes and make sure that this is part of that. So presenting and talking to the Child Protection Working Group, doing that at local and country levels, and also at a global level. So I think mapping and understanding those processes, as well as being strategic around where we engage with our findings and with the results from the reports is what we're trying to do with this.
Fantastic, thank you. All right, the questions are slowing down a bit, thankfully. Though thank you very much for all the questions, everyone. They're fantastic. So a couple more. Does the CPI look at linkages or overlaps with other systems such as health or education or social protection systems? And one more for now. What do you believe the threshold would be to say that the child protection system is strengthened regarding the number of services or utilization, % increase of participation, or changes in policies and procedures?
Okay. So on the first question, there are clear overlaps with some aspects of health in that response to SGBV or response to abuse or violence often engages with the health sector. So there is some measure of that. And there's quite a lot of aspects of education. There's more aspects of attendance of schools, access to national education systems, and feelings of safety in school. The greater focus on the education system is really falls within the same purview within UNHCR as child protection, whereas health is, you know, a whole system in an unto itself, and is quite difficult to map and include within already quite a large area that we're trying to map. So there are those linkages and overlaps. We're not measuring a number of health outcomes. We are measuring psychosocial outcomes, as I mentioned, which, you know, do come under health, but we do recognize, as most systems mapping does within this field, that there are these linkages and overlap with other aspects that go into creating a protective environment for a child, but that we can't fully include those systems, and yet recognizing and understanding how they operate, how they support children is really important. The question of the threshold is really interesting, whether we say something is strengthened versus not strengthened. At this point, I'm not confident that we've come up with the answer to that we have hypothesized that, you know, a percentage change of X, or, you know, the presence of X versus Y would mean strengthened or not strengthened. I think we're looking at change and degree of change, and that within that, whether there's some cutoff or some binary that we would say strengthened versus not strengthened, is something I think we would need to have more discussion around with the data in front of us. So I think I'm interested in that idea of threshold and need to think it through a little bit more. But to me now, the understanding is really around change and direction of change and degree of change, and that change is system strengthening. Whether we can say it is present or not present is another question.
Great, thank you so much. Are you ready for a few more?
Sure.
All right, so here's another group of some. One audience member would like to know whom was asked the different aspects of the study questionnaires. Was it children or their families, members of the households, caregivers? One person would like to know who is the report referring to when you mention caregiver? And the third one is, how much involvement do the refugees have in these settings in determining or contributing to the content of the items in the CPI?
Right. So who was asked which questions is within the surveys, there's a full adolescent survey, and that whole survey is asked to the adolescents who are between 13 and 17, and then a full caregiver survey. And so the items within the index, some of them are drawn from the adolescent survey, but they're not asked specific or different questions that are part of the index. And then the other items within the index that are populated by data are asked to key informants who are from implementing partners, who are UNHCR staff people, who are refugee leaders, who are different partners within the humanitarian setting. So we try to have a cross-section there to have an interview that touches on the key aspects of the index, but also ask people to give some general perceptions of strength of the system and aspects that we then use to interpret the CPI. So the question of who is the caregiver, so when approaching a household, data collectors would approach a household, and the person who is identified there as a primary caregiver is the person who is interviewed as the caregiver. So they may or may not be biologically related to the adolescent who then participates. They live with that adolescent and they have some role in that adolescent's care, but whether they are a foster parent or an aunt or it's a different kind of living arrangement is explored in the survey, and we do have data on that. But primarily we're actually biological caregivers, and we're usually women in most of it across the three studies. In terms of the caregiver and how they were referred to in the focus groups, so in the focus groups, adolescents referred to caregivers who were discriminating against unaccompanied and separated children, those were caregivers who, live in the same household as unaccompanied separated children, who may have been assigned as a foster caregiver, may have informally taken on that child within their household. So that was sort of directed by how the adolescents defined those caregivers, more so than the survey, where that was when the data collector approached a household, found the caregiver at that household, and then conducted that interview. The question around how much involvement do the refugees have in what is part of the CPI and part of the surveys is not very much, or not at all. The aspect that we have greater input in and that we hope to strengthen and use more is the qualitative aspect of the focus groups. And so what they're actually able to do in that space is shed light on, well, maybe the items in the CPI are just not relevant to us. And that's what really came up in that issue of unaccompanied and separated children in this case. Not so much that they directly said those things are not relevant, but that they brought up different topics, different issues that we really hadn't identified through only using the items. And so I think that question is bringing to light, you going in with instruments that have been fully developed from the outside and haven't had any consultation, you're obviously going to come across gaps and mismatch and problems in what you're measuring, and we're hoping to use the focus groups to really shed light on that.
Thank you very much, Sarah. So we have two last questions, and I believe that you've touched on both of these in some other answers. So the first is, how do you manage the mandatory reporting in these data collection sites as you are learning various things about child protection issues? And the second is, how replicable do you find your approach, considering that you'd like multiple settings to be adapting the CPI and using it?
Sure. So in terms of mandatory reporting, in these studies, we've had a waiver for mandatory reporting. For each study, at the end, the data collector asks the child whether they've disclosed or not within that interview, because we know, also that there will be children who don't disclose in the interview and who also may need services, whether they have a problem they would like to talk to anyone else about, whether, here's this list of services, is there any of these types of services that you would need at this point? And we also, had a very strong training on responses to distress and recognizing when to end or when to, pause an interview. So we don't have mandatory reporting as part of these studies because of the questions around confidentiality, and that we can't go into the interview guaranteeing confidentiality and then engage with mandatory reporting. The issue of replicability, I think I've now been involved in leading 3 of these studies in different settings. Well, the 2 in Uganda and 1 in Rwanda, and there are aspects that take a lot of time and resources, and the training and getting data collectors engaged and then going to households. So I think that there are aspects of the study that could be adjusted to make this more replicable, potentially take less time, potentially take less resources, and and be more feasible within the implementation, say, of a baseline study or implementation of a country office that wants to engage in this work. I also, in a way, it's very, very intensive because we've had a short period to do it in. Whereas if in a country office they had this index and they said, we want to populate and understand the strength of the system, but we're happy to fill out this information and get this information in a period of time that, of 2 to 3 months, that would obviously be less time intensive in some ways. There would be, some limitations and weaknesses of that, but that would be able to give you that view without necessarily having the 3 weeks of, very intensive data collection throughout the refugee settlement or the context that you're working in. So I do think there are aspects of the index that are replicable. I also think that there's, we might do some thinking around whether there's a version of the index that relies less on the surveys, and so there's, more reliance on the key informant interviews, and that's a little bit easier for partners to do in different settings.
And one quick follow-up to that, do you have any concerns that organizations would not consider waiving the mandatory reporting while adopting the CPI?
I think, no, I mean, I think that that's something that have to be context by context, and that there are some, certainly organizations that wouldn't, and they need to be clear in communicating when they do those surveys what it means to disclose within that survey. So there are certainly studies that have mandatory reporting, and you would likely be looking at lower disclosure, and that would be that limitation. But I mean, I know that there are organizations that work in these contexts that can't waive that requirement.
Fantastic. So with that, I would like to wrap this up. First of all, I would like to give a huge thank you to both Sarah and Gita for these wonderful presentations and answers to questions and the discussion. This is very interesting. For all of our audience members, if you would like any more information, please contact Sarah Meyer for the CPC Learning Network. Her email is on the screen, sarah.r.meyer@gmail.com. If you have any questions for UNHCR, please contact Joanina Karugaba, whose email is also on the screen. And just so everyone knows, this webinar has been recorded and will be posted on the CPC Learning Network website later this week. That website is on the bottom of the screen. There you also will be able to find multiple other CPC Learning Network webinars, as well as the report on this research. So thank you very much for joining us, and thank you again, Sarah and Gita. I hope you all have wonderful mornings or afternoons, respectively, wherever you are. Thank you.